Okay, injury recovery protocols. This one is all about the knee. First of all, I just want to mention that this is not to replace any physiotherapy that you might be going through if you've just had surgery or if you have quite a serious injury. I recommend continuing to follow whatever program you have or seeking out an expert who can help you more at that one-on-one personalized level. This advice here is more for if you've been cleared to go back to sport, but you're not really feeling that strong through your knee, you're not very confident. These are some exercises that we can implement to help get you feeling confident in your body again. That being said, when it comes to knees, there's a few different aspects that we want to look at. Knees should be able to rotate somewhat, not enough, like when you're being heel hooked so that you tear your meniscus, not that much rotation, but there is an element of rotation there. When we think about the muscles leading into the knees, we've got the quadriceps, the tibialis, the calf muscle, and the hamstring. And so it's important to strengthen all of these aspects. Now, it's also important to focus not only on the knee, but also the hip and the ankle. Now you might be thinking, okay, well now I'm just doing a full body program. So what can happen if you're lacking internal or external rotation in your hip? The force has to go somewhere if you're being put under sort of some rotational force. So if you don't have the ability to rotate your hip enough, your knee may be the thing that cops the damage. So in this one, we're going to target just specifically the knee joint, and then there's going to be other videos that you can have a look at that are targeting hips and ankles, etc. So when it comes to injury recovery protocols, one of the main things and the most important thing that we want to do is to work within a pain-free range. Now that doesn't mean discomfort. Some of these exercises might be uncomfortable, but we need to establish the difference between discomfort and pain. Okay, so the first one we're going to do is targeting our VMO muscle and the quadriceps. And what we're going to do is slowly increase the range and the weight over time. Okay, so you're going to figure out which level you're at given your injury and your current abilities. So I'm going to take you through the options. So the first one here, we're literally just going to tap our heel out in front of us. Some things we don't want to do with all of these levels is stick our butt back. We want to keep our weight forward over our knee. The benefit of this also is that it does help with ankle mobility. So once you can do 30 like this, and there's no pain and it feels good, so we want to move up to some elevation, just a couple of inches, and like a 10 or 20 kilo plate in your gym works wonders. From here, we're going to, again, stick with that same form, hips staying forward, going for about 20 reps on each leg. Now, before we actually go up a level and increase that range further, we want to add some weight. Okay, so grab a couple of dumbbells, you can do it with a barbell on your back, and build up to 20 reps again. Aim for about 50 to 60% of your own body weight before you drop the weight, move up a level, and then start the process again. You don't really need to go higher than about 6 inches. That's going to be plenty in order to sort of build that strength there. And then there are other exercises that we do to regain that full knee bend, which is so important. Okay, this is a very simple calf exercise. It's also going to help stretch out and strengthen those hamstrings as well. You'll need something to raise your toes on. Again, it doesn't have to be a slant board. It can just be a plate, just anything that you can put your toes on. If you're not very flexible, you'll want to get some yoga blocks, a P-bar, a roller, anything that you can put your hands on. A bench works as well. From here, we've got straight legs and we're simply doing calf raises. So this would be the sort of baseline level. If that starts to feel okay, you'll move up to something a little more intense on the angle there, making sure you keep those knees straight. We're doing these calf raises. As you get more flexible, you can get lower and lower until you find yourself on the floor or even elevating your feet further. So this one is for the calves and a little bit of the hamstrings as well. So now we're going to look at the tibialis, which is the little muscle that runs along your shin here. This is a tib bar. You don't need one of these, definitely. You can just hook a kettlebell onto the end of your toes. You can get a dumbbell and tie it with a tie down. Otherwise, I think these are pretty cheap, but to be honest, this is the only use for them. So we're going to tighten that one up. If you have one, you'll know that they're much more comfortable. If you've got shoes, this is all I've got, so we'll have to deal with that. Now, whether it's the tib bar or it's a dumbbell attached to your foot or it's a kettlebell hanging off your toes, we want to aim for about 10% of body weight and 15 reps. We want to keep the knee straight and we're just pulling toes to knees, back down. Toes to knees, back down. Now you can also move this around, do some circles, move in different ways. Once you sort of get into it and feel it out, it feels really nice, especially if you've got some tight ankles going on. So yeah, 10% body weight. Now, if you don't have access to any of those and you want a body weight option, what we can do are some tib raises. So all you need is something to lean your butt against, feet out. I'm just going to pull your toes up to your knees there. Same movement. With this one, it's obviously a little easier, so the reps are higher. So we want to aim for 25 to 30 reps. Okay, so we've worked through some basic movements for our tibs, our calves, the donkey calf raise, a little bit of hamstring involved in that one, and then some short range quadriceps work. Now we're going to move on to something a little more advanced. So if you feel like those things there are simple and you need something further to increase those gains, then we're going to go to a couple of more strength related movements and working on restoring that full knee bend in that front knee. So if you have tight ankles or tight hips, you may want to start a lot higher than this, even something like a bench from the gym, you know, that you lay on. So front foot on the elevation, whatever elevation it is, and it's important to find out what elevation works best for you. Now what we're doing here was just really working on getting this front leg butt to our front leg heel. The heel can come up a little bit, trying to keep the back leg as straight as you can and the chest nice and tall, and then pushing back. So a typical lunge would be straight down like this. This one we really want to work on getting our knee as far forward over our toe as we can. Now to increase the difficulty on this one, you add weight obviously, and you also decrease the height. However, like the other one we did, the taps, I recommend increasing the weight first, getting it stronger in that position, then decreasing the weight and decreasing the height, and then rebuilding the weight. All right, now we're talking hamstrings. So single leg RDL, you absolutely cannot go wrong when it comes to building hamstring strength. There's obviously plenty of other exercises as well. I really like this one though for those recovering from knee injuries because it adds in a lot of stability. You can really load it up nice and heavy as well. So there's many variations of the single leg RDL. When it comes to adding weight, you can use a kettlebell, you can have a barbell, you can use dumbbells. It literally doesn't matter. Whatever you feel you're getting the most out of and can really feel those hamstrings working. So the setup, I prefer the B stance. So that means I've got one foot, I'll show you from the side. The front leg is my working leg, back leg is just back slightly about a foot and then out to the side, just ever so slightly. And the goal of this back leg is like a kickstand on a bike. It's just to help me balance. So most of my weight should be through this front leg here. I like to hold the weight in the opposite hand. From here, I'm keeping my chest nice and strong. I'm not sticking my butt out or doing anything crazy, but I'm just having a nice neutral spine. I'm going to try to keep my shin vertical as I push my hips back until I feel the limit of my hamstrings. Then I engage my glutes and I come back up. So down and then back up. Now yours might look a little different. You sort of might get to here and you feel your hamstrings, and that's totally fine. What we don't want to do is be reaching for the ground and then just turning it into a back movement. Nothing wrong with working your back, but today we're trying to target the hamstrings. So neutral spine, pushing back, and then coming back up. The other really important thing to try and figure out is to engage your hamstrings on the eccentric component. So rather than just passively going down and waiting for your flexibility to kick in, we want to try to engage the hamstrings on that eccentric component of the movement as well. It can feel a little difficult and a little weird to get used to at the start, but try and see how you go. Okay, and lastly, we've just got some really simple knee rotations. So you're gonna sit, you can do this on the ground as well, that's totally fine. I like to hold my shin or the top of my calf, and I'm not moving, like I'm not doing it with my arms. It just helps me to find that rotation. And so we're gonna go toes in and then toes out. You can try it with your toes a little lower, twisting them out, twisting them in, and I'm trying to really find the rotation component through my knee and push into that end range rotation. Can feel a little weird, but that's just what it is. So we're gonna do 20 reps basically. Okay, so that is our knee injury recovery protocols essentially. So remember that these are just designed to help bridge the gap between when you've been cleared, if you've had surgery or a serious injury and you've been working with someone. Once you've been cleared, you're back on the mats, but you're not that confident just yet, or maybe you've just done a little twinge, it's nothing serious enough to go and see someone else. These exercises will help you to bridge that gap. So as you can see, most of them can be done before you get started at jiu-jitsu. Sometimes you need a wall or somewhere to sit, but they'll take 5 or 10 minutes and just get some blood flow to the general area.